Diabetes is a prevalent chronic condition in modern society, and it isn't just about elevated blood sugar levels. Much like a slow-burning time bomb, it can surreptitiously damage major organs and dramatically impact seniors' quality of life and independence. Even when patients don't exhibit the classic three polys, excessive thirst, excessive hunger, and frequent urination, or unexpected weight loss, persistently abnormal blood sugar can gradually give rise to a series of hidden, life-threatening complications. In this guide, we delve into 5 key areas where diabetes poses serious risks, interweaving real-life examples and offering practical prevention and management tips to empower each reader with the knowledge to safeguard their health. 1. Kidney damage, the silent crisis of high blood sugar. The mechanism behind it: when blood sugar is not well controlled over time, the tiny blood vessels in the kidneys are continuously assaulted by a high glucose environment. This chronic exposure can damage the structure of the glomeruli, the filtering units of the kidneys. As the blood vessel walls thicken and harden, proteins begin to leak from the bloodstream, leading to early-stage microalbuminuria. Over time, patients may start experiencing swelling and elevated blood pressure, eventually progressing to full-blown kidney failure or uremia. Real-life snapshot: take the case of 66-year-old Susan. For years, Susan ignored subtle fluctuations in her blood sugar, believing her routine levels were within acceptable limits. During a regular checkup, however, her urine tests revealed slight abnormalities. Subsequent follow-up assessments confirmed that she had developed diabetic kidney disease. Fortunately, after her doctor revised her treatment plan, focusing on a low-protein diet and incorporating moderate exercise, her kidney function stabilized, helping her avoid further deterioration. Prevention tips: regular checkups, schedule tests for microalbuminuria and kidney function every 6 months. Dietary management: limit protein intake and adopt a low-salt, low-fat diet to reduce kidney stress. Blood sugar control: maintaining consistent and healthy blood sugar levels is the most effective way to ward off kidney damage. 2. Retinal damage, a fading world. The mechanism behind it: long-term high blood sugar can adversely affect the delicate blood vessels in the retina, leading to diabetic retinopathy. The elevated glucose levels increase the permeability of the retinal vessels, causing small hemorrhages and swelling. Over time, these events trigger abnormal new blood vessel growth, which eventually disrupts the retina's normal structure and compromises the passage of light, potentially leading to irreversible vision loss. Real-life snapshot: consider 70-year-old John, who paid little attention to routine eye care. One day, he started experiencing blurry vision along with dark floaters dancing in his field of view. After a detailed exam at his ophthalmologist's office, John was diagnosed with diabetic retinopathy. While a series of anti-vascular endothelial growth factor injections and laser treatments helped prevent further deterioration, the existing retinal damage remains a permanent challenge. Prevention tips: routine eye exams: visit an eye care specialist at least once a year to catch early signs of retinal changes. Manage blood sugar and blood pressure: keeping these parameters stable is crucial for protecting the small blood vessels in your eyes. UV protection: wear anti-UV sunglasses when outdoors to minimize additional stress on your eyes. 3. Peripheral neuropathy, the daily battle of numbness and tingling. The mechanism behind it: repeated fluctuations in blood sugar can also take a toll on nerve fibers. Diabetic peripheral neuropathy typically manifests as numbness, tingling, or even a burning sensation in the extremities, which can significantly disrupt balance, coordination, and daily functioning. High blood sugar, acting over years, disturbs the normal metabolism and blood supply in nerves, leading to their slow degradation. Real-life snapshot: at 68, David initially brushed off occasional numbness in his feet as a normal part of aging. However, one night he experienced such severe pain and burning that it forced him to seek immediate medical advice. Following a comprehensive neurological evaluation, David was diagnosed with diabetic peripheral neuropathy. His doctor recommended a combination of medication, acupuncture, and gentle exercise to help stimulate circulation and nerve function while emphasizing the importance of strict blood sugar control. Prevention tips. Early intervention. Don't ignore even mild numbness or discomfort. Consult a healthcare provider as soon as symptoms appear. Gentle exercise. Activities such as walking or practicing Tai Chi can improve blood flow to extremities and reduce nerve pain. Protect your feet. Consistently inspect your feet for any signs of injury or infection, as impaired nerve function may delay awareness of issues. 4. Cardiovascular and cerebrovascular diseases, the hidden menace in your vessels. The mechanism behind it: high blood sugar levels set off a cascade of metabolic disturbances that can severely damage the endothelial lining of blood vessels. This damage accelerates the process of atherosclerosis, whereby fatty deposits build up along arterial walls. Unstable plaques may form and rupture, resulting in blockages that significantly raise the risk of heart attacks and strokes. Additionally, the inflammatory response induced by hyperglycemia further weakens the vessel walls, compounding the danger. Real-life snapshot. Take 72-year-old Robert's scenario. Robert had long battled dual challenges: high blood sugar and high blood pressure. One day, he developed chest tightness and shortness of breath and was rushed to the emergency room. Catheterization revealed early signs of coronary artery disease. Although he underwent a minimally invasive procedure and his medications were adjusted accordingly, his doctor stressed that without steadfast lifestyle changes and rigorous blood sugar management, his risk of future cardiac events would remain alarmingly high. Prevention tips. Integrated monitoring. Keep a close watch on your blood sugar, blood pressure, and cholesterol levels simultaneously. Regular cardiovascular exercise. Engaging in activities like brisk walking, swimming, or cycling can fortify your heart and improve circulation. Anti-inflammatory diet. Increase your intake of antioxidant-rich fruits and vegetables while cutting down on red meat and fatty foods to support vascular health. 5. Diabetic foot and infections, a stealthy risk of amputation. The mechanism behind it: diabetes often hampers circulation, particularly in the lower extremities. The resulting diminished blood flow and reduced nerve sensitivity make the feet highly vulnerable. Minor injuries such as cuts or abrasions can easily escalate into infections that are difficult to heal. Because nerve damage can dull pain sensations, even slight injuries might go unnoticed until they evolve into severe ulcers, conditions that, if left unchecked, could ultimately lead to amputation. Real-life snapshot. Linda, a 69-year-old woman, once experienced a seemingly insignificant scrape on her foot. Assuming it would heal on its own, she paid it little mind. However, the wound gradually became infected and, despite multiple treatments, nearly progressed to a point where amputation was a possibility. Her doctors drove home an essential lesson: for diabetic patients, daily foot inspections and prompt attention to even minor injuries are non-negotiable for preventing severe complications. Prevention tips. Daily foot inspections. Carefully examine your feet, including the spaces between your toes, daily to catch any emerging issues early. Proper footwear. Invest in well-fitted, comfortable shoes that minimize friction and pressure, and avoid prolonged standing whenever possible. Seek prompt treatment. Any sign of redness, swelling, or wound, even if seemingly minor, warrants immediate medical evaluation to prevent infection from spreading. Comprehensive management. Building a robust health defense. Diabetes is not a problem that affects a single organ system. It is a multifaceted condition that calls for a coordinated, multi-pronged approach to prevention and management. To avoid or delay the onset of these serious complications, seniors should focus on several key areas of self-care. Regular monitoring. It is imperative to check your hemoglobin A1C every 3 to 6 months to closely track your blood sugar levels and adjust your treatment plan as needed. Balanced nutrition. Adopt a diet that minimizes high sugar, high fat, and high salt foods. Instead, incorporate whole grains, legumes, leafy greens, and appropriate servings of fruits to maintain steady blood glucose levels. Consistent physical activity. Aim for at least 150 minutes of moderate exercise weekly. Whether it's a brisk walk, a session of Tai Chi, or swimming, regular movement greatly improves vascular health and aids in blood sugar regulation. Stress management. A positive outlook and a balanced lifestyle play significant roles in controlling diabetes. Proper rest, mindfulness practices, and time management are crucial for maintaining both physical and mental well-being. Educational empowerment. Engage with diabetes self-management classes, community health seminars, or support groups. Regular learning and sharing of up-to-date information empower you to manage your condition more effectively. Multidisciplinary care. Work closely with specialists from endocrinology, ophthalmology, cardiology, and neurology to construct a personalized and comprehensive care plan. Such collaboration is key to mitigating the risks across every affected system. The insidious nature of diabetes means that its harmful effects may silently progress throughout the body. By taking proactive steps, through rigorous blood sugar monitoring, lifestyle modifications, and integrated healthcare management, you can build a formidable defense against diabetes-induced complications. The cases of Susan, John, David, Robert, and Linda serve as poignant reminders. Early intervention and diligent self-care can transform a potential time bomb into a manageable condition, preserving not only your health but also your independence. Starting today, let every meal, every walk, and every glass of water be infused with science and hope. With steadfast determination, you can preserve your vitality and look forward to a future filled with energy and optimism. Remember, with discipline, care, and a strategic approach, diabetes can be managed effectively, empowering you to live your best life in the golden years.